Welcome to the world of medical coding. Seen commercials about medical coding schools and wonder if the profession is right for you? With the field expected to grow faster than other occupations, now is the time to consider a future in medical coding. There is a national shortage of certified medical coders in healthcare facilities, hospitals and doctors' offices. Qualified medical codes can even choose to work their own hours from home. Add computer skills, and there are plenty of high-paying opportunities for those willing to hit the books. Your potential as a medical coder. Medical coding salary is above average with steady employment. Coding specialist analyzes health records and designates the codes for each procedure and diagnosis. It is one of the few health professions where you do not have to work directly with the patient. Instead, medical coders work with patient records. Coders sort through the information to identify life-threatening allergies and report which qualify for healthcare reimbursement. This information is then inputted into a software program they maintain. They also do administrative work such as scheduling, staffing and adding or decreasing healthcare services. Quality standards and productivity are required to be a top-earning medical coder. For this reason, it pays to be detail-oriented, accurate and organized. Besides good time management, it is important to be an active listener. Coders work with a team of professionals and must be comfortable asking questions and with memos and other forms of office communication. Taking biology and computer courses in high school are a good start. A medical coder has a complete understanding of what is written in medical records. Learning medical terminology, physiology, pharmacology, and anatomy is the next step. You have to learn to update knowledge in the field continually, so lifelong learning is required. Medical coding salaries vary by experience and where you work. For example, a doctor with a solo practice may only pay in the low to mid-30s. Working for a government facility or directly for the insurance company brings in the $40,000 range. A high-paid medical coding consultant can bring home nearly $60,000 a year. For the amount of schooling needed to enter the profession, medical coders make a good living in a comfortable office environment. Earning a medical coder salary starts with education. There is a couple of ways to go depending on your goals. There are 4-year university programs, associate degree programs, online boot camp courses and vocational classes available. Those who take the shorter diploma programs typically receive comparable training to a college degree in the field. The goal is to acquire enough knowledge to pass the medical coding certificate exam. The abundance of paperwork required to file insurance claims keeps medical coders in high demand. Changing government regulations and the lack of qualified applicants translates into many job opportunities. Earning an impressive medical coding salary is just a few steps away. Is medical coding school right for you? To be a medical coder, you must have a handle on a variety of topics. The background knowledge is needed to understand the human body, symptoms and diagnosis. Since the main point of coding is getting payment, learning how an insurance claim works along with the basic third-party reimbursement is crucial. For this reason, a solid education includes medical terminology, health data requirements, anatomy and physiology, coding systems, data analysis as well as healthcare reimbursement methods. Are you a good match for this growing field? People who enjoyed science in high school work well in the healthcare field. Because accuracy is essential, medical coders must have an attention for detail. The fast pace is perfect for people who like to keep busy, but also means time management and organization is key. Since medical coders work in a team, being an active listener and a clear communicator is also important. If this sounds like you, medical coding school will set you on the path to make from $25,000 to near $60,000 a year. The government does not have a set standard of education needed to become a medical coder. There is a variety of schooling options to get you started in the field. There are than 200 schools across the country offering an associate's or bachelor's degree in health information management. Though this route is a longer process, it can give you a leg up when landing the most lucrative jobs. Certificate programs, often less costly, are also designed to deliver the knowledge needed to pass certification. The vocational route is offered at community colleges, state vo-tech centers and even private boot camp seminars to get you job ready. Online medical coding school is a convenient option that offers the same material with flexibility and cheaper tuition costs. No matter which route works for you, there are a couple things to check out to ensure you enroll in a legit program. The school should clearly provide the curriculum of courses and topics that are covered. Consultation time with teachers should be available to offer feedback and instruction when needed. They should also stand behind your results with established placement programs and resources to help you find a job. Check to see if the coursework will help prepare you to sit for the CPC or AAPC credentialing exam. If the online route suits you best, at a minimum check to the physical address and make certain a live person answers the phone. Employment for medical coders is expected to grow faster than average through 2014 according to the Occupational Outlook Handbook. The question is, are you ready to be in demand? What to look for in a medical coding program? When looking for a medical coding program, there are hundreds of options to choose from. They span from bachelor to associate programs, certificates and diplomas offered online. With all the different names and program lengths, how do you know which one to choose? The best way to decide is by being able to tell which one will give you the tools needed to pass the certification test and land the most lucrative jobs. The American Academy of Professional Coders (AAPC) and the American Health Information Management Association (AHIMA) are the recognized source for medical coding certification in the medical community. Both offer the most popular credentials. AAPC offers the Certified Professional Coder (CPC), which focuses on coding used in patient settings like emergency rooms and doctors' offices. AHIMA Certified Coding Specialist (CCS) for those interested in hospital and inpatient coding. Since employers feel confident applicants CPC or CCS certified are qualified, you should pick a program that will prepare you to pass the exam. It is possible to start working as a medical coder without first passing the certification test. For example, you might work as a receptionist at a doctor's office and learn coding as part of your job responsibilities. Experience alone is enough to work in the field and eventually pass the exam with a few supplemental courses. Most people do not have access to this information and will have to find a medical coding program to pick up the info. Whether a traditional associate degree, distance learning course, or a consultant bootcamp, the program should have the following course types to prepare you to sit for either the CPC or CCS exam. Coding classes. There should be a variety of coding sets covered teaching the principles of the primary codes including CPT, HCPCS Level 2, ICD-9 CM. Advanced coding for payment system and outpatient services is a plus. The titles of the classes will vary, but should teach how to determine diagnosis by practicing coding patient medical records. Introduction to Healthcare Records. This course will teach you how to read hospital charts and give background information on medical record keepers, and billing and coding organizations. Health Information Management shows where health information comes from and how it is used, including how to compile, number, file and store the information. Medical Terminology. The course studies medical terminology through anatomy, physiology, pharmacology, laboratory, terms and abbreviations. Fundamentals of Medical Science. The class outlines diagnoses, surgical procedures, signs and symptoms, medical equipment, to help understand current procedures and therapies. Health Statistics and Registration. A review of the collection of data, common computations, and how to present and report data. Computers. In health science topics teach how to use computers for database management, make spreadsheets, manipulate graphs and other computer skills needed with health information management. Professional Seminar. A class that reviews professional conduct and the important topic of how to make a resume and conduct interviews, to help with finding employment. A medical school program that teaches you practical material as what you need to get started in the field. Focus on absorbing the information so you can apply for a job straight away. Employers will give you a test to see if you can apply what you learned. Or you can sit for the exam straight away. It doesn't matter what form of schooling you chose, you receive the same certificate once you pass the exam. Certification in hand, you now has what you need to be a top earner in a stable healthcare career. What you can do with medical coding and billing certification. Medical coding and billing certification is your ticket to one of the fastest growing professions in healthcare. Medical coding and billing specialists apply the correct codes to patient diagnosis and medical procedures. This data is then used to make bills and submit claims to Medicare, Blue Cross and other insurance companies. Without the medical coding and billing specialist filling out insurance forms, the doctor's office or other service provider does not get paid for their services. There is an industry-wide demand for qualified medical billing and coding specialist. Certification almost guarantees a long lucrative career in healthcare administration. There are several reputable professional associations offering certification programs. American Association of Medical Billers (AAMB). The AAMB Basic Certification is the Certified Medical Billing Specialist (CMBS) certification. It is an introductory billing and coding exam that tests medical terminology, medical office insurance, insurance carriers, ICD coding, Medicare, CPT coding, and fraud and abuse knowledge. The AAMB also offers a specialized CMBSH certification covering inpatient and outpatient hospital billing. An advanced CMBSCA certification is also available to prove competency in chiropractic billing and coding. American Health Information Management Association (AHIMA). The AHIMA has one of the most popular medical coding and billing certifications. They offer the nationally recognized Certified Coding Specialist (CCS) credential focusing on hospital inpatient coding. American Association of Healthcare Administrative Management (AAHAM), formerly known as the American Guild of Patient Account Management (AAHAM), offers several professional certifications. The Certified Patient Account Technician (CPAT), designed for the hospital side of patient accounting, and the Certified Clinic Account Technician (CCAT) for the clinical or physician side of coding. The American Academy of Professional Coders (APC). The Certified Procedural Coder (CPC) represents the highest standard in physician office coding and billing. Coders with the CPC certification are said to make 20% more than their counterparts. Although it is not necessary to have a medical coding and billing certification to work, credentials will make you highly sought after in the job market. A vocational program or online course can help you prepare for the exam. Expect to know medical terminology in human anatomy and physiology. Also, have an understanding of third-party reimbursement and the insurance claim process. You must also have a firm grasp of the basic IC9CM, CPT and HCPCS Level 2 code sets. Distance learning classes and online courses are also viable options to quickly get up to speed. For extra help, a multitude of study guides and books available to help prepare you for examination. A medical coding and billing certification is the cornerstone to a new career, for anyone willing to learn a new skill set. Are you ready for a medical coding job from home? A medical coding job from home can be a dream situation. You can set your own hours and finish your work without anyone breathing down your neck. By staying home, you save money on transportation costs and childcare. Not to mention the tax write-offs for your home office. Working medical coding at home also means you can increase your volume to make more money and enjoy more variety in your work than working on location. A medical coder is needed to record data accurately for other healthcare professionals. A successful work-at-home career in the field is more than just assigning codes. You also prepare paper and electronic claims and issue them to the insurance companies. Software programs are used to enter patient information and post payments. Regular clerical duties such as mailing patient statements are also part of routine responsibilities. There are a couple ways to have a medical coding job from home. One is finding a position that allows employees to work remotely or contract with an outsource company. In most cases, you can sign up for more than one service to keep work consistent. By going this route, you may still qualify for the company's 401k, healthcare and other benefits found at a traditional brick-and-mortar job. Another way to work at home is being your own boss and start your own medical coding business. Going this route, you contract with single physician offices and offer to do their billing and coding. To make the most money, you have to be qualified. Most remote coding jobs require either a CCS or CPC certification and a few years of experience. With all of the medical coding programs available, passing a certification test is a simple part of the process. The main obstacle is getting the experience when first getting started. By taking a lower position as a reception, you can receive on-the-job training to get your coding experience before acquiring an actual coding job. Once you have the experience under your belt, you can confidently apply for remote positions. If starting your own business, consider taking specialized certifications to establish a niche. You will be able to acquire more clients and earn top dollar. Taking action. Whichever route you chose for a medical coding job from home, keep a few things in mind. Having flexibility and no one telling you what to do can be a blessing and a curse. It takes discipline to work from home. This can be difficult with personal distractions like children and telephone calls. Besides separating work and home life, you are also responsible for budgeting, bringing in new work and tracking the receipts for all those tax write-offs. If you are able to do everything above, working from home as a qualified medical coder may be right for you. For more help starting your medical coding business, consult one of the many at-home courses available online.
What is medical billing? Medical billing. This is probably not the first time you've heard of this word, and you pretty much have a basic idea of what the phrase connotes. However, you should know that most people have the wrong idea of what medical billing is in reality. Often, medical billing is equated with what medical transcription is, or what medical coding is, when the three areas separate and as distinct from each other as night and day. While it is true that all three of them are somehow related, and sometimes even their responsibilities overlap, it still doesn't change the fact that medical coding deals strictly with codes, and medical transcription is strictly on transcribing doctors' notes. So, what is medical billing, then? Some people say it is the doctor's key to getting paid for services rendered. Others say that it is a process of submitting claims to insurance companies. But these descriptions are vague. What is medical billing? Perhaps the question "what is medical billing?" is better answered with this definition of the term. Medical billing is practice management. It involves front office skills, with emphasis on billing and accounting, insurance claims processing, and making decisions concerning practice's financial aspects. What is medical billing compared to medical coding and medical transcription? Medical billing is more comprehensive in scope and broader in its range of responsibilities compared to medical coding and medical transcription. The front office also means acting as an executive secretary to the practice, dealing in clerical work such as patient scheduling, clearing appointments, documenting patient visits, recording diagnostic and treatment procedures, and organizing medical records using a medical billing software program. What is medical billing, and what are its responsibilities? The medical billing professional's job starts with the office visit. You will handle everything from scheduling the appointment to ensuring that the patient makes it to his position. After the doctor sees the patient, depending on the services provided and the examination, he will create and update the patient's medical record. Here you will know what medical billing is. The medical billing professional then organizes these records according to a system earlier adopted by the practice. This record contains a summary of treatment and demographic information related to the patient. The medical billing specialist will have to organize these records according to their contents to provide easier access in case of another visit or some such circumstance, and create the billing record, which is the document submitted to either a clearinghouse or an insurance company.
Medical billing and coding courses online. Hospitals, medical offices, clinics, practices, doctors, and even insurance companies are in great need of professional medical billing and coding specialists to deal with insurance handling complexities. Medical billing and coding are among the fastest growing occupations in the United States today, right on par with nursing, caregiving, and therapy. But this great need in the market for more medical billing and coding specialists should not be taken so rashly, because the profession is still a service based on trust. No doctor in his right mind would hire just anybody to handle confidential information about their practice unless you have the necessary skills and training to show them. If they could help it, they'd instead not hire any third-party individual to handle practice management for them. But the problem is that liability costs each year for medical offices, even the small family-owned ones, are steadily growing. Medical billing and coding, as preventive medicine, is one of the best solutions to reduce costs. Medical billing and coding make it possible for medical offices to make sense of their complicated practice management information system and streamline everything for greater efficiency. Medical billing and coding specialists are experts when it comes to streamlining accounts, as well as handling patient scheduling and appointments and claims processing. Such responsibilities involve a high degree of skill which you can only get from medical billing and coding courses online. Because medical billing and coding involve trust, doctors would naturally look for individuals who have the proper educational background to handle the challenges posed in practice management. Such knowledge is one you get from courses online. Courses online cover everything about healthcare, from medical billing to coding, medical terminologies, coding systems, and even to necessary front office skills such as word processing and running a medical billing software program. Many schools offer such courses online. They may be two-year vocational colleges, institutes, to terms online that last for about 6 months. It does not matter how much time you spend learning the basic concepts of medical billing. However, what is essential is knowing how to apply the things you learned while enrolled in those courses online. Some courses online include externship in their programs. An internship allows students to apply what they know during the early part of their systems online on real medical billing set up with a third-party medical billing company. HIPAA compliance. HIPAA stands for Health Insurance Portability and Accountability Act. It is a group of regulations and standards which require significant changes to how healthcare organizations handle information management. HIPAA covers such aspects of medical billing and coding, security, patient record management, reimbursement, care management, and stringent codes for uniform transfer of electronic data, including routine changes in billing and coding. Learning the twists and turns of HIPAA may take time, and time is something that most medical billing and coding specialists can ill afford. For this reason, software developers have come up with a type of software program that incorporates HIPAA compliance into the system. The result is the new HIPAA-compliant medical billing and coding software. HIPAA-compliant medical billing and coding software build the codes and standards of HIPAA into the system's structure. Using this type of software product saves you from the hassle of studying the HIPAA guidelines and evaluating if your software systems meet them. Now, you no longer need to spend all this time learning the works because your HIPAA-compliant software will do all the work to adhere to HIPAA-EDI compliance rules. The three sets of standards. HIPAA-compliant medical billing and coding software adhere to three sets of standards. These are: Transaction and code sets privacy security. To meet regulation compliance, HIPAA-compliant medical billing and coding software must also cover the following entities: health plans, health care clearinghouses, health care providers. The benefits of HIPAA-compliant medical billing and coding software. The primary purpose of HIPAA-compliant medical billing and coding software is to assist medical billers to meet the federally mandated HIPAA requirements. However, HIPAA-compliant medical billing and coding software may also have several other benefits aside from mere compliance. For instance, HIPAA assessment tools allow the billing and coding agency to manage HIPAA assessments for each of its clients. They help medical practices and billing and coding services increase productivity, reduce account receivables, and increase cash flow. Another benefit of HIPAA-compliant medical billing and coding software is that it can simplify complicated administrative and financial data transactions. It does this by defining new codes and unique identifiers and by standardizing transactions and EDI formats. Hospitals, physician offices, home health agencies, nursing homes, affiliated providers, payers, employers, data services, and regulatory agencies are all impacted by HIPAA. Having a HIPAA-compliant medical billing and coding software program helps significantly improve efficiency in practice management. Medical billing outsourcing. To outsource or not to outsource? That is the question that's been plaguing almost all medical offices these days. Your practice is growing, and it is getting busier with each day that passes. Your staff is getting frazzled servicing all those incoming patients, not to mention answering phone calls and whatever crisis your office might be going through that day. Plans don't necessarily apply to life because things are never predictable. As a doctor, you know this more than anyone. Although coding errors might be a fact of life, if you do your medical billing and coding, you don't have time for it. So how do you deal? The industry tells you that medical billing outsourcing is the answer. But is medical billing outsourcing beneficial? In a word, absolutely. true that there are cons to medical billing outsourcing, but the pros more than make up for it. With the burden of medical billing handled outside your office, medical billing outsourcing can do a lot for your practice. Just imagine you and your staff without the problem of medical billing and coding in the way. Imagine how much work you can do in a day when you don't have to waste time trying to correct coding errors. Medical billing outsourcing makes that possible and more. Medical billing outsourcing will allow you to develop relationships with new patients and more time for marketing your practice. Having a medical billing outsourcing firm handle your medical billing will result in greater accuracy, leading to expediency in your revenue for your practice. Because they are dedicated to servicing you, a medical billing outsourcing service will have the time to check and double-check claims to make sure they are accurate. That is certainly a far cry from your in-house staff that could be interrupted or distracted by day-to-day office goings-on. Because of this, more frequent mistakes can happen, which equals more delays in reimbursement. With medical billing outsourcing, you can stop worrying about this problem and focus on the more important aspect of your job: saving people's lives. But that's not the most significant benefit medical billing outsourcing offers you. Since you've decided that you wanted to try medical billing outsourcing, you will find out that the biggest pro of hiring an outside firm to handle your billing is practically zero overhead costs associated with in-house employees. Costs such as salaries, benefits, year-end W-2s, unemployment claims, state and federal taxes can be dispensed. Just freeing yourself from managing extra people is already a big bonus, but medical billing outsourcing goes beyond that. It can free you from the additional costs. So, to outsource or not to outsource? The answer should be evident by now.
Medical billing and coding career. People in the world today are not getting any younger. As they age, the need for working professionals in the medical and healthcare services professions will continue to increase. That is why there is no more right time to get into a medical billing and coding career than now. The sheer number of new patients and insurance claims alone ensure that medical billing and coding career will be in demand for many years to come. If you pursue a medical billing and coding career, there is no doubt that you are seeking a job that is much needed. Medical billing and coding have been frequently described as the doctor's key to getting paid. In a more accurate description, medical billing and coding refer to practice management. More often than not, processing medical and insurance claims is a very time-consuming task, but unfortunately, it is something that all medical offices and clinics must take up. Coding errors and erroneous patient information are usually much higher if the person handling your medical billing and coding and accounts payable are not professionals trained in medical billing and coding career. Such could lead to a high rate of insurance denials or inaccuracies, which could prove disastrous to medical practice in the long run. This is precisely the reason why trained medical billing and coding career specialists are in such demand today. What a career in medical billing and coding means. As previously mentioned, medical billing and coding is the process that enables a doctor to get paid for medical services rendered. Ever since the medical field's technological explosion and the proliferation of health insurance plans, every medical office has experienced a need to maintain financial records and collect money from patients and insurance companies. Hence, my medical billing and coding career soon began to take definite form. The medical billing and coding career person is like any regular employee, in that he or she works 40 regular office hours from Monday through Friday. It is a primary desk job, and most of the time, you'll be dealing with billing and coding officer billing and coding department work. To handle the many responsibilities that a medical billing and coding career connotes, the medical biller must be fluent in the medical billing and coding industry's intricacies. Each time a doctor treats a patient, the procedure and including diagnosis and treatment is noted in the medical record. Before the medical biller can make any insurance claims, the insurance companies require him to provide them with a list of procedures. Each medical practice has its code. The medical billing and coding specialist's job is to track these codes and the associated fees they connote.